Are you someone who feels that their breasts feel nice in bras, however, without bras, they feel big, heavy, and saggy at the bottom and empty at the top? Well, then this surgery is for you. This is what is called as autoaugmentation mastopexy, or in other simpler words, it is lifting up your breast with filling up of the upper areas of the breast, called the upper pole of your breast, with your own tissues that have shifted down. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon, director of plastic surgery at Skin Zone Aesthetics in Borivali, West Mumbai. So, say if you're a woman who does not really have deflated breasts and is really happy in how her breasts look in a push up, then for you, this is a surgery that may work very well. This is a surgery in which we basically redistribute the fat and the glands from the lower part of your breast into the upper part of your breast, along with lifting of the nipple areolas up onto the most projecting part of the breast. So we correct both the sagging that happens with the breast and also the hollowness that happens in the upper part of the breast. So what do we do in the surgery? Basically, if this is your breast, you will have to understand what we basically do is take the tissue from the lower area of the breast that is sort of increased in weight, and we push it to the upper area of the breast. This is what we do in autoaugmentation mastopexy. When we say mastopexy, it's basically lifting up of the breast, especially the nipple areola complex, which is again usually pointing down there. So we make to point it up there, and that is what a mastopexy surgery is. Autoaugmentation is the part where we use your own tissue and augment the upper part of the breast. So here we don't use any external things like an implant or fat to sort of augment or increase the amount of projection, especially in the upper part of the breast, and that's why it's called as autoaugmentation mastopexy. We sort of cut out and remove the skin on the lower part of the breast from this area, that would be excess, and cone the breast to lift it. In this surgery, you have to know you're going to get a scar, which is what we call as the lollipop scar, which goes around the areola like that, and then a straight scar like this, which goes down the center of your breast. This scar is not visible even if you wear sort of a bikini, because that is the area that will be covered, but it gives a very nice shape that a lot of women like. So this is what is autoaugmentation mastopexy. If you need to know more about it, do let us know. We will explain more in detail. You can give us a call or come down and visit us. We'll be happy to help.